Are private clinics a solution to Canada's healthcare crunch?
I paid for a private MRI, and it happened so much faster than um, waiting in line for the public one. And I'm sure maybe I freed up a spot for somebody else.
The idea, I guess, of having pay as you go is why can't you put that into the public healthcare system and combine the forces in one healthcare system as opposed to trying to split it up, and then you end up with people who can't afford to pay the private clinics, missing out in the healthcare that other people can afford. So I'd like to see it distributed evenly, and I don't know if you can do that with private health.
I believe they are not. I don't think that capitalism should be involved, part of public health care.
Well, I feel they would help. We have to try different things. So give it a whirl, see if it works, see what happens. Status quo is not acceptable. So
to be able to pay more and get better treatment or quicker times, ethically, I could see the issue there. If it's a private thing, I can see the benefit, but I think just kind of improving what's available to everyone should be kind of the focus, I guess.
Some people will be left out. We got to go back to old Tommy Douglas's way, the public health.
I do. I really do think we need them. The services would be faster. Pay for it. People are walking on bad legs for years and years. And then it makes the rest of their body suffer for it. So we need private health care. Yes.
I think they will help immensely. For those who have the money to use them, maybe the waiting lines are reduced to the point where those who can't afford private care will maybe have better access to public care.
No. It's just not the Canadian way. That's just my opinion. It's just not the Canadian way. We expect our government to pay for our health care. Right, that's why we pay our taxes. Then why have private clinics?
Yes and no. It'd be a shame to give away the kind of health care we have now, which has been taking care of its people for years and years. On the other hand, there's so many people, and if people can afford to pay for something, it frees up beds and hospital care for the people that can't, right? So they've got more opportunity. It's a tough one. Yeah, but I think both.
No, I don't think they are. I think that everyone has the right to free healthcare, and I think that healthcare should just be a human right. Everyone should be able to feel good all the time.
If some people, I'm not saying everyone, but if some people can afford private health clinics, then why not? At least we have a backup options for some people to get cured and get right medical treatment on time. So why not?
I'd say no. I would prefer that we continue to support public health through government dollars. I just hate to see it go to the place where not everyone can get free and easy access to healthcare.
That is a very good question. I don't think privatized healthcare is the way to go, but that's my inner hippie speaking out. I think healthcare should be accessible to absolutely everyone, whether you're rich or whether you're like me and you're broke. So I don't think privatized healthcare is the way to go. It makes me nervous, and it doesn't bring good things with it, I believe.
Yes, they are, and I think it would take a lot of stress off the public health system, where those who can't afford to pay for private health care, if you want to choose to pay for private health care, you should have that option.
My mom's a registered nurse, so I think our healthcare system it's not perfect the way it is, but I don't think going private's the answer to any of the problems. I think more access is necessary, not less. So making things private just makes it harder for people in tough situations to get access to it. So I don't think so.
I work in healthcare, so I see it from both sides because I'm also a parent with sick kids. So I think the real thing needs to happen is funding more university positions for nurses and doctors, and
making those positions available to local people without having to bring in lots of people from other places.
It could be part of the solution, but I'm very convinced that there are a lot of talent pool just wasting away because they can't go right into the system right away.
Yeah, we're not getting the best care, unfortunately, with our current system, and ultimately, I think you do have to take care of you have to be your biggest advocate with the healthcare system, and if that means spending out of your pocket to get better treatment, sooner treatment, then that's an option, I guess. It's not for everybody, obviously.
Staffing is a real problem. Doesn't matter where you are, whether you're in healthcare or you're in restaurant industry, teaching, and somewhere maybe private clinics can make a go of it. They're private entrepreneurs, and if they make it work, it's going to help everybody.
100% no. I very, very much disagree with private healthcare. There's a lot of research showing that it does not shorten wait times, that it does not deliver a healthier population or better care to our population. I work in healthcare and I am adamantly opposed to privatization. I think this would be kind of the end of the Canada that we're proud of and Canada as we know it. We need healthcare for everybody, not only those who are in kind of, the upper income brackets and can pay for it.